Hello class, this is lecture for week 11 and this is on chemotherapy agents. So let's look at the PowerPoint real quick. So here we go. Okay. So we are going to talk about antineoplastic agents. And what are antineoplastic agents? These are the agents which are given for patients who have cancer. Okay, antineoplastic agents, anything that will be going against cancer. What is cancer? Cancer is abnormal proliferation of cells that could cause tumor formation, and then it is actually excessive cell growth. Now, we probably have heard like a lot of people go through cancer and then the treatment is chemotherapy, is the medications that we give to manage cancer. So chemotherapy are the medications that are given to manage cancer or treat cancer. Now, causes of cancer, what is the cause of abnormal proliferation of cells? It could be genetic predisposition, it could be viral infections, constant irritation and cell turnover, excessive stress levels, lifestyle factors, and environmental factors. Types of cancers. What are different kind and types of cancers? So types of cancers are solid tumors, which are carcinomas. There's other sarcomas, and then hematological malignancies. So solid tumors, as we know, like there's times when we notice like, oh, we have like a cell growth on this tissue and we can actually see it, such as skin cancers. And then sarcomas are more muscle related. Hematological cancers are something that happens in the blood, such as excessive RBC production, excessive WBC production, such as leukemia. So those are hematological malignancies. Cancer. So as abnormal cells continue to divide, they lose more and more of their original cell characteristics, and they exhibit the following. Anaplasia. Anaplasia, what is anaplasia? Cancer cells lose cancer differentiation and organization and unable to form normally. So meaning they're not normal. They're just losing what's inside them and they're just being proliferating. Autonomy. Cancer cells grow without the usual hemostatic restrictions that regulate the cell growth, and this allows the cells to form a tumor. Cancer, also metastasis. So like there's tumors which will start in one area and they will go to different areas. So such as some patients start with colon cancer. It starts in the abdomen, then it goes to the lungs, it goes to the kidney. So that is metastasis, like going to different areas of the body, going all over. And then there's patients who get diagnosed with stage 4 cancer. Their metastasis all over the body. So they have, let's say it started with kidney, it went to the liver, then it went to the lungs, then it went to the brain, then it went to the bone. So that is metastasis. So how far has the cancer spread? So cancer cells travel from place of origin to develop new tumors in other areas of body. Angiogenesis. Now, angiogenesis is abnormal cell release enzyme to generate blood vessels and supply oxygen nutrients to the cell generating growth. So angiogenesis is new blood vessels formation. And cancer cells rob the host cells of energy and nutrients and block the normal lymph nodes. So what happens is there's these cancer cells, they will proliferate, increase, form a tumor, then goes to other places such as metastasis, and then there's like new blood vessels that are forming and new formation of new things. So that is all cancerous, and it's just we have to find a treatment to remove it, either do a surgery or try to give the medication to kill those cells. That's the treatment for that. Tumor growth, as we see now, if you look at this picture, you see that those cells, the blue cells, are all grown like abnormal growth in those cells. Now those cells are not even normal. They also lose their the regular normal area of their life, and you just see like abnormal functions, abnormal growth, and then that is called tumor formation, malignant tumor formation. So we know metastasis is going to different places when the cell growth increases, and it goes to different places, such as organ to organ, such as a kidney cancer goes to liver, and from liver it goes to lungs, and from lungs it goes to the brain or bones, so all over the body. So that's metastasis. Now, how would we treat cancer if someone has cancer? Destroying cancer cells through several methods. There's several methods of destroying it. Surgery to remove them. Either we can chop it off, through a knife, like take a knife, cut it off, done deal, right? Or which is surgical interventions. Done through, like patient is, let's say if there was a kidney tumor and the doctor takes him for surgery, take that kidney out or that cancerous portion out, and that way we remove that. So that's surgery, and that could be done in primary area if there's like metastasis all over the body, so that's just not good. So then stimulation of immune system to destroy them. So either we can stimulate the immune system, give them certain medication that will actually kill those cells. Then radiation therapy. We can expose those tumors to the radiation to destroy those cells, and drug therapy to kill them during various phases of cell cycle. So we can also give them medications to kill them during the various phases of cell cycle. Anti-neoplastic agents. Now there are medications which are available that will be doing the work of degrading that cancer tissue or cancer cell. So medications are alkylating agents, anti-metabolites, anti-neoplastic antibiotics, mitotic inhibitors, hormones and hormone modulators, cancer cell specific agents, then protein tyrosine kinase inhibitors, and others. So these are just the classification of those drugs. Now alkylating. So first one is alkylating agents. It is used to treat slow growing cancers such as lymphomas, leukemias, myelomas, some ovarian cancers, testicular cancer, breast cancer, and pancreatic cancer. Alkylating agents known to cause hepatic and renal toxicity. So all these chemotherapy medications, they are very, very strong. Remember, whenever we give a medication to our patient, we always check their liver function test and kidney function test. Now, chemotherapy medications are strong in killing those cells, like normal cells, right? So we want to make sure that their normal liver function, kidney functions are normal before we start them, and we monitor their liver function, kidney function tests as we do our medication treatment. Now, nursing diagnosis could include pain related with GI, central nervous system, skin effects of drug. So we want to make sure whenever a person's getting those medications, we want to check what could be the GI problems, nausea, vomiting. So we give them Reglan or Zofran, which will reduce their nausea, vomiting. Then we give them we want to make sure that their CNS functions are normal. Then we want to check for any allergies, if they're having rashes, irritation. Then body image disturbances related to alopecia, skin effects, and impaired fertility. Imbalanced nutrition when the nutrition, we know that the nutrition was not very balanced. It could cause, because of a lot of nausea, vomiting, which these medications could cause, less than body's requirement. Then risk of infections. So risk of infection could be because bone marrow depression happens with these medications. What is bone marrow depression? With these medications will cause bone marrow produces RBC, WBC, and platelets. So bone marrow depression means it will reduce the amount of production of RBC, WBC, and platelets. So RBCs are red blood cells, and WBCs are white blood cells, which are protective cells. And so we want to make sure when our RBC level goes down, patient suffers from anemia. When WBC level goes down, patient will suffer from infections. And then when platelet level goes down, then patient could suffer from bleeding disorders. So those are three things that happen once we know that when bone marrow depression happens. So for anemia, we give them some iron supplement. When their WBCs are low, or they have risk of infection, we want to make sure we do something called as neutropenic precautions. So what are neutropenic precautions? Which means reverse isolation. Also means we do not introduce that patient to people who have infections. We don't introduce them to people who are sick and have active infections. Also, we tell them we limit the use of fresh flowers, fresh fruits, fresh vegetables, because they could have some infections. So all food has to be cooked, flowers, and no introduction of flowers or anything, because that could cause introduction of infection. So this is risk for infection. Next is fear, anxiety related to diagnosis or treatment. So the third part, which I want to also add on with when we were talking about bone marrow depression, is also the third one is platelet levels goes down. So platelets are, what are platelets? These are the cells that causes blood clotting. Okay, so platelets causes blood clotting. So we want to make sure that when their platelet level is low, they have very high chance of bruising, bleeding tendencies. So we inform the patient, like if they have any signs of bleeding in the catheter, urinary catheter, any signs of bleeding in the bowel movement, or any GI bleeding, they have to inform the physician or the nurses right away. So that is what we also monitor their CBC levels continuously. Okay, so RBC, WBC, and platelet level. The third one is so the second last one is fear, anxiety related to diagnosis and treatment. So fear and anxiety, that is just part of being. So we usually tell them to join a social support group. That also helps, like talking about what they're going through to some family members or friends. They are who actually could listen to them and be non-judgmental and just more of a good listener. So that and then support groups of patients who have gone through cancer or family members have gone through cancer, they actually listen to what they're going through, and they just support them by just being listening and just like helping them. Okay, this happens, like, and also being sympathetic and empathetic when they're talking about their sickness. So support groups, fear, anxiety could be relieved more with support group, which is just a part of treatment. Some church groups, prayer groups are also very helpful when they are going through treatments such as those. Next is deficient knowledge regarding drug therapy. Deficient knowledge regarding drug therapy means they don't know what's going to happen. So it's nurses' responsibility there, or whenever we start a medication, we can give them printed information about what we're going to give them and how the treatment's going to be, what would be the part of treatment, and what to expect, the expectation related to that medication. Next is antimetabolites. The antimetabolites are used to treat various leukemia. So what is leukemia? Abnormal proliferation or increase of WBC, white blood cells. It could be two types: acute lymphocytic leukemia and chronic lymphocytic leukemia. GI and basal cell cancers also could be treated with antimetabolite medications, and metabolites are usually administered as a part of combination drug therapy. Antimetabolites. One of the examples of antimetabolites is methotrexate. What is the indication? Symptomatic control of severe psoriasis, rheumatoid arthritis. Adverse effects could be fatigue, rashes, alopecia, ulcerative stomatitis, hepatotoxicity, severe bone marrow depression, intestinal pneumonitis, chills, fever, and anaphylaxis. And then we can also give them some folic acid forms, which could be given with methotrexate to protect organs and normal cells from adverse side effects. And the name of those folic acid supplements are leucovorin rescue. So those are antimetabolites. Antineoplastic antibiotics. Antineoplastic antibiotics, one of the examples are doxorubicin. What are the indications? When do we give it? We can give it in acute lymphoblastic lymphoma, acute myeloblastic leukemia, neuroblastoma, breast cancer, ovarian cancer, Hodgkin's and non-Hodgkin's cancer, AIDS and related Kaposi sarcoma. These are just names of different kinds of cancers. Doxorubicin. What are the adverse effects? It could cause cardiac toxicity, alopecia, nausea, vomiting, mucositis, and then red urine, myelosuppression. What is myelosuppression? Again, bone marrow suppression, fever, chills, and rash. Patient can only have maximum dose in their lifetime due to cardiovascular effects. The drug is considered as vesicant, and the nurse must see positive blood return in IV prior to administration. So we want to make sure that there are, whenever we're giving them through IV, we want to make sure the IVs are patent, and then has to be proper there, because these medication causes extravasation, which is if this medication goes in the tissue, it causes severe irritation. So we want to make sure that the IV is working properly, so it doesn't have any localized side effects. So that's localized side effects: irritation, swelling, and redness. Next is mitotic inhibitors. They interfere with the ability of the cells to divide by blocking DNA synthesis, causing cell death. Pharmacokinetics given IV, since they are not well absorbed in the GI tract, metabolized in liver, excreted primarily in feces, making them safer for the use in patients with renal impairment than antineoplastics that are cleared through the kidney. Adverse effects: bone marrow suppression and thrombocytopenia, anemia, pancytopenia, and GI effects. Pancytopenia is when a patient has low counts in all three types of blood cells, such as RBC, WBC, and platelets. It's a part of bone marrow depression, as we talked before. All right. Next is mitotic inhibitors. Next is vincristine. Vincristine is, when do we give vincristine? Indications is acute leukemia, neuroblastoma, Hodgkin's disease, non-Hodgkin's lymphoma, Wilms tumor, rhabdomyosarcoma. Adverse effects could be ataxia, cranial nerve manifestation, neuritic pain, muscle wasting, constipation, leukemia, weight loss, hair loss, and death. Safety measures. Safety measures for chemo prep and administration. Prepared in a special setting using the hood that cuts down lung exposure. Then the nurse should avoid any skin, eye, and mucous membrane contact. Proper PPE, personal protective equipment, such as gloves, protective goggles, mask, respirator to protect the lungs. Use items go into the yellow box for biohazard disposal, and double flush the patient's waste, which is urine and poop and pee basically goes. All of that goes. We want to make sure that they are discarded properly, because then all of these medications, they will be in their body secretions, and so we want to make sure that we put all of those in the yellow bag. Extravasation. Now, whenever we're giving these medications, extravasation is when this medication could leak into surrounding tissues when given through IV. A serious tissue damage can occur. Symptoms include severe pain, scarring, nerve and muscle damage, infection in severe cases, and if it's too severe, then we might have to do amputation of the limb. And prevention. Use the distal vein for IV and avoid small veins or wrist or digits. Make sure there is a blood return before administering. Check the site frequently and ask patient to report any discomfort in the area. Hormone and hormone modulators. What is the action of hormones? They act on receptor sites or hormone specific to block the stimulation of growing cancer cells sensitive to the presence of that hormone. Examples is breast cancer. Pharmacokinetics is it is readily absorbed from GI tract, metabolized in liver, excreted in the urine, and that is with pretty much all medications. Contraindications. When would you not give those medications? If patient has severe allergies, they have hypercalcemia, means their calcium levels are high, pregnancy, lactation, bone marrow suppression if their bone marrow is already not producing enough RBC, WBC platelets, and their kidneys and liver is not functioning properly. Adverse effects could be menopause-associated effects, bone marrow suppression, GI toxicity, including hepatic dysfunction, hypercalcemia, and cardiovascular risk. Drug-to-drug interactions include oral anticoagulants. Hormones and hormone modulator. Tamoxifen, treatment for metastatic breast cancer. Treatment for metastatic breast cancer means tamoxifen is a very, very common medication, very commonly used. It reduces the risk of invasive breast cancer in women with ductal carcinoma in situ. Adverse effects include hot flashes, rashes, nausea, vomiting, vaginal bleeding, menstrual irregularities, edema and pain, cerebrovascular accident, and pulmonary emboli, which is blood clots in the lungs. The patient should use barrier contraceptives to prevent pregnancy during therapy. And so this tamoxifen is one of the commonest medication. You will probably see quite a bit of questions on tamoxifen. And then in my next lecture, I would actually review some questions on, from the website on this area of anti-neoplastics. So that, and then you will see like what are the things which are mostly important. So most of the questions on chemotherapy would be what are the side effects of these medications. And then side effects are, because the side effects are all of these chemotherapy medications or all anti-neoplastic medications could cause, to just sum up, they all cause GI disorders, severe nausea, vomiting. We give them, before we start chemotherapy on a patient, we always give them, what do we give? We give them anti-nausea medication, right? Then also know this part, whenever there's a patient who's getting cancer treatment, they also are long-term patients. They might have central lines because this therapy is not very good for peripheral lines. It is good for the central lines because peripheral extravasation causes severe reactions, localized reactions. So nausea, vomiting is GI upset. Is for second is extravasation. So they mostly have central lines like a PICC line or a port implanted in their chest, and that kind of stays there for like maybe a year or 2 years or until when they're getting chemotherapy. Patients with cancer have long-term treatment, so we want to make sure that we keep everything sterile whenever we do their treatment. We give them any medications. We want to keep everything sterile as much as possible. Okay. And then sterility and keeping, and then remember the isolation is reverse isolation, meaning we don't allow any infection to touch them, meaning we give them all fully cooked food, no fresh flowers, no fresh fruits, no fresh veggies allowed. Everything has to be really cooked, and anybody who has infections not allowed in their room. And we also use our PPE, proper PPE, whenever we're giving our patients chemotherapy. Then we want to make sure that they're not having any, now remember, bone marrow depression causes anemia. It could cause, so remember, low WBC could cause infection, low RBC could cause anemia, and then low platelets could cause bleeding disorders. So we want to make sure that we are checking for any bleeding disorders, any severe infections, and monitoring their blood counts every day. We also check for liver function, kidney function test every day pretty much to make sure that their numbers are okay. Then body image changes because of alopecia, when they lose a lot of hair. Then sometimes we tell them, okay, you can use, what could be done for that. They can use scarves, they can use wigs, and then the new hair do grow up after once the chemotherapy is done. And then also join a support group. Joining a support group helps them with anxiety, with going through body image disturbances, with whatever they're going through. They could actually talk their their heart out to someone. So joining a support group, a prayer group, a church group is a good thing. And then is also patients should use. Then also remember that part. So that's just in a nutshell for all chemotherapy agents. That's pretty much it, and that's for this lecture. And then I will do one more from the review of the book, and then this is from Professor Robbie Lee's lecture. So thank you for listening, and we will catch up later.